and it's a Medium article. It was done by Melanie Walker, a senior advisor to the president of the World Bank. And the title of the article is Healthcare in 2030, Goodbye Hospital, Hello Homespital. And I assume homespital just means we're going to be moving out of the large facility, hospital facility. Let me just give you a little excerpt, just give you some background on this. When I look forward to the future, I see a very different trajectory. Who needs a hospital when you can prevent and treat conditions from the comfort of your own home? The global burden of disease is largely vascular, with heart attacks and strokes the biggest cause of death around the world, and therefore preventable with better understanding of risk factors. Rates of traumatic injury are falling and will continue to decline as we introduce driverless cars and robot workers for risky tasks. And well, 80 is the new 60 and all the regenerative options on the horizon. She goes on to say by 2030, the very nature of disease will be further disrupted by technology. So disrupted, in fact, that we might have a whole lot fewer diseases to manage. The fourth industrial revolution will ensure that humans live longer and healthier lives so that the hospitals of the future will become more like NASCAR pit stops than inescapable black holes. You will go to the hospital to be patched up and put back on the track. Some hospital practices might even go away completely, and need for hospitalization will eventually disappear. I share this article. It's interesting to me. This is probably the rosiest picture I've ever read of healthcare 2030. Yeah. I mean, it's really rosy. And I wish healthcare would move this fast. And I wish the move towards, disease prevention, specifically obesity and diabetes and other things, I wish I could see an end in sight to that technology is going to bring around. But does the nature of the hospital change as a result of the pandemic? I mean, people received care in the home. We had some chronic conditions being monitored in the home. We had CMS start to reimburse some chronic care in the home. Do we think that that's the first step, that we are going to see more home-based care?
I think it's absolutely already been happening more, possibly in pockets, especially for the payer provider health systems whose incentives are aligned a little bit differently than the typical fee-for-service model, if that makes some sense. The hospital at home movement was already underway. It was already progressing. I think COVID and the pandemic accelerated a lot of things that will continue even, in not necessarily a post-COVID world, because it looks like that may never happen, but in a future world, I'll phrase it that way. I think it's just going to continue to accelerate. Things that the pandemic did thrust to the fore are things like virtual visits and doing more in the home to create capacity at the hospital for things that had to be managed more acutely, if that makes some sense. I would say even some of the COVID care ultimately was delivered as a hospital at home type service for good reason. It was a better and safer model. And if you really think through it, it's impossible to get a hospital acquired condition if you're being cared for in your home. So there's a lot of reasons to think that may be a better model for a lot of conditions.